My name is Jessica Little. This is for Veterinary Nursing Care, Course 2439, Section 34430, Summer 2019. For heart and lung auscultations, there's a couple of ways you can do it. When you're counting beats per minute or breaths per minute, you can do it a few ways. One way you can do it is count how many beats or breaths in 10 seconds and multiply it by 6. Count how many in 15 seconds and multiply it by 4, or count it in 30 and multiply it by 2. Some abnormalities we're looking for with the lungs include crackles or wheezes. This can indicate pulmonary edema or pleural effusion. For the heart, we're listening for whooshing or swishing noises, which can indicate a heart murmur. With the heart, we're listening for a regular rhythm and equal time intervals between. We can hear a sinus arrhythmia, which is normal, and what that means is there's an increased heart rate with inspiration and a decreased heart rate with expiration. So to start, we're going to listen to Austin's lungs. And with the lungs, you want to listen to 9 quadrants on both sides of the chest. So we're going to listen to all 9. I'm going to listen for those crackling or wheezes. And you ideally want to listen to each quadrant for a cycle of 2 breaths. So Austin's respiratory rate, I counted for 10 seconds and I got 3 breaths in those 10 seconds. So 3 times 6 is 18, so he's about 18 breaths per minute. So now I'm gonna listen to his heart, and where I wanna listen to his heart is gonna be just over the elbow on the left-hand side of his chest. So for Austin's heart rate, I'm getting about 80 beats per minute. The next thing that we want to do to check his heart is to check his femoral pulse, which is behind the stifle, and this should have the same intensity and frequency as the heart rate. So I'm going to locate it with 3 fingers. So the intensity and the pulse rate is good for his femoral pulse. It equals his heart rate. For ECG reading, we want our patient in right lateral recumbency, which is where we have Austin right now. We have a 3-lead machine, so I'm going to hook up our leads. We have a right arm, a left arm, and a left leg. Our white is our right arm. I'm going to place it on the front, right at the elbow. Our black is our left arm, right there at the elbow, and then our red is our left leg, which goes right about the stifle. We'll wet it with some alcohol. Any artifacts, we can minimize those by moving our leads distally down his arm to combat that. So once we get a decent reading on Austin's EKG, we can print it. So we can evaluate this. When we evaluate our ECG, we're looking at 4 basic features: the heart rate, heart rhythm, a measurement of waveforms in the intervals, and the mean electrical axis. So the vertical measurement of our complexes represents the strength of our electrical impulse, and our horizontal measurement measures the time in seconds. So what we're looking for is we're looking for the rhythm of our heartbeat. We want to know if it's regular or irregular, and if it's irregular, is it irregular, or is it regular. So Austin actually does have a irregular rhythm, and we can see it here. So we see 3 QRS complexes, some lag time, another QRS complex, another one, and then another grouping of them here. So what this tells me is that since we have a regular pattern of irregularity, we have a sinus arrhythmia going on. Another thing we want to look for is we want to be sure that for every P wave we have a QRS complex, and for every QRS complex we have a P wave. As long as we have that, we have a sinus rhythm going on. If not, we could have some sort of arrhythmia going on. But for Austin, we do have a P wave, which is this little bump here in front. Our Q is here, R, and an S. So we can see that evident throughout all of our complexes. As we look at our QRS complexes, we want to know if they are supraventricular or ventricular in appearance. If we have supraventricular complex, these arise from above the ventricles, meaning our impulse comes from our sinus or AV nodes, or it comes from the atria, which is utilizing a rapid and the normal conducting pathways in our heart. So our QRSs would be normal and upright, as is shown here in Austin's reading. A ventricular origin complex arises from the ventricles itself, which is not the normal conducting pathway and would look odd on our complex here. It may appear wide and bizarre shapes on our QRS complex. So when using a rabies restraint pole, you want to be very careful that you don't hurt the animal in any way, because it can close on their neck pretty tight. The way this one is used is it's a twist one. So you twist the handle and pull it to the length, and then you can lock it by twisting it back the other way, which is really nice. Then you can move the animal where you need to. When you would want to use this is if you have an animal that is suspected to have rabies or is just completely unruly and there's a fear that it will hurt someone. So we have Turtle here who isn't aggressive and who isn't suspected to have rabies, but to demonstrate it, you want to have your move nice and big, and you want to gently get it around their neck and then pull gently, and then you can control and lock it in place, and you can control the dog where you need to, like so, while keeping the dog at a distance from you. And then to release it, we're going to unlock and push our pole back, and he can walk right through because he's so small. For disinfecting a kennel, we want to spray down all of the sides inside of our kennel, so the top, sides, back, bottom, the front and back of the door, and even our lock, and then let the disinfectant, and we have chlorhexidine here, to sit for 5 minutes before we wipe it down. So let's spray it down. So that's going to sit for 5 minutes. So now that our disinfectant has had a contact time of 5 minutes, we are going to respray it. And then we wipe it down, and we start from top to bottom. That way we can brush any hair down to the bottom, and we're not just wiping the hair all around the rest of the parts of the kennel. So if you were to start at the bottom, you'd collect the hair and then start wiping it all over the inside and the top. So we start from the top down. Forget the inside of our door. And the outside. And now we have a nice clean cage for our next patient. So to begin the test, I have our strips here that are sterile, and what I want to do, first thing, I'm going to bend at a 90-degree angle right at that blue mark, or 5 millimeter wetting per minute mark. That way it's still sterile, and that part is going to sit just under the lower eyelid, between the lower eyelid and the cornea. I don't want it to be between the lower eyelid and the third eyelid. And what this is testing for is that we have an appropriate amount of tear production. So we're gonna leave it there for 60 seconds. So if our reading is between 10 and 15 millimeters of wetting per minute, this is borderline treatment of KCS, keratoconjunctivitis sicca. If there is clinical signs of this, we want to start treatment right away. If it's below 10 millimeters of wetting per minute, you definitely want to start treatment for it. Otherwise, if we're at 15, we're in the 15 and above, we're in an ideal range. In a minute, we are at 15, so Austin has good tear production. So I'm going to take my strip with our bend. I'm going to get, stay. So after a minute on this side, we're at the 10 millimeters of wetness per minute, which is a little low, so we talk to the doctor if they want to start any treatment for it. So I'm going to calibrate our tono pen right here. So the first thing we need to do, I'm going to turn it upside down and hit our button twice, and it's going to come up with cal for calibrate. And then once it beeps, turn it up. Got our lines. Wait 15 seconds or so. We're good to go. I'm going to place proparacaine in my patient's eyes for the tono pen. Just a drop in each eye. Seven. 8. Such a good boy. And 13. So that was our left eye. So now we're going to do our right eye. Do the same thing. And I'm just gently tapping on his cornea. 6. 4. And 8. Fluorescent stain is generally used to detect corneal ulcers and any abrasions or roughness on the cornea. So what we're going to do, I have our fluorescent strip. I'm going to pull it out, and I'm going to wet it with some sterile saline that I've pulled up in a syringe here. Just a couple of drops. So we're going to take it in Austin's eye, and I'm not going to touch the cornea, but the conjunctiva of the upper eyelid. Just a touch. And blink a few times. If there's any roughness in his eye, it's going to fill in those nooks and cracks. I'm going to flush out the excess with some sterile saline. And I know you're being a good boy. I'm going to take our blue light, and we're going to take a look at his eye. So he's not quite strong enough, so I'm going to turn off the light. And we're going to look in his eye for any fluorescence of our stain, which I don't see any, so his eye is clear of any ulcers or any abrasions. And then the last part, we're going to flush his eyes some more and get out that stain. I know, you're being a good boy. So there's no excess stain. Oh, I know, you're being a good boy. So for anal gland expression, Brian here is going to restrain turtle just like this so that I have access to his anal glands. And the first thing I want to do, I am wearing gloves. I'm going to get some lube on my finger. On one hand, that's going to be inserted into the anus. And my other hand I'm going to have on the outside with a little piece of gauze. So we lift the tail and insert, and the anal glands are going to be at about 8 and 4 o'clock on the inside. So gently and slowly insert, and they feel like little grapes. I know. And with the index finger on the inside and my thumb on the outside, and gently massage the material from the anal sac out. And the anal sac feels like a little grape. I know, it's kind of big boy. So we have some material. So now we go to the right side and do the same thing. So his anal glands, you can tell, are a little small, hard to express, and the material is a little bit, it's thick. So now we can collect our material and clean him up a little bit. I know, hands-on. So I'm going to demonstrate how to administer an enema on Turtle. Turtle doesn't actually need an enema, but we'll go through the steps leading up to. So I have some soap here in our middle bin. And what I'm going to do is I'm going to put some warm water, about body room temperature, nothing higher than body temperature because you don't want to hurt your patient. Once I'm happy with that, we have our warm water. I also have a syringe and a catheter. I'm going to pull up some water, soapy water in our syringe. Have that ready. And then I want to lube up our catheter for insertion into the anus. So I have some lube on a paper towel here. And I'm going to lube up about the bottom quarter of our catheter. You want to lube it up nice and well. That way you're not going to meet too much resistance going in. Attach it to our catheter, and I'm actually going to prime our catheter with our solution. And then when we're ready, this is when you would insert it into the rectum a little ways, administer your fluid depending on what the doctor wants, how much they want to administer. Slowly take out your catheter and then place your patient in the kennel, and hopefully they're going to defecate. If they don't, you can repeat the process in about an hour. When placing topical medication on a patient, especially a cat, on cats and dogs, you want to part the fur all the way down to the skin. That way you can see the skin and the medication can be absorbed into the skin, and that way it's not just sitting on the fur and then possibly being washed off. The other important thing, especially with cats, when you're doing topical medication, you don't want them to lick it off, especially a flea medication. So when you apply it, you want to apply it high up on the back of the neck, to a place where they can't reach around and lick, so that they can't ingest it accidentally and cause other issues. So that's what we're gonna do with Leon here. We're gonna apply some flea medication to the back of his neck. So I've got some hair parted, and I have his medication, and squeeze all of it into the area, making sure that it all goes on his skin and that it's not just hanging in the fur. We can use two different methods. We can either place the cleaning solution directly in the ear or place it on our cleaning swab. So for Turtle, I'm going to take our cotton ball, put a little bit of medication on it, and place it in the ear, wipe it around. We can even massage the ear a little bit. And then wipe the ear out. The ears aren't too bad. And then our last part, our medication, we're just gonna drop Put a little bit just inside the ear. Massage it around. Cleaning and medicating a cat's ears is similar to a dog. There's two methods that you can do it. You can take your cleaner and either place it directly in the ear, or you can place it on your cotton swabs. So I'm gonna actually, for Leon here, I know. You're a good boy. You're a good boy. I'm gonna place a little bit in his ear. He's gonna shake, that's fine. And massage it around a little bit. And then I'll take our cotton ball and start wiping. Actually, we can place it in there and still massage. That way the cotton ball can soak up some of the cleaning solution. And wipe it out, some of that gunk. We can also take a Q-tip, place some of our cleaning solution on the tip of it, and wipe out the ear canal that way. And then the last step, we're going to take some medication. And again, same idea, we're going to place a little drop of it right in the ear canal. I know. And then massage the ear. Woo. Massage your ear a little bit. And voila. And then we do the same to the other ear as well. So I'm going to administer subcutaneous fluids to Austin here. I have my 500 milliliters of lactated ringers ready with an administration set primed and ready to go, and a brand new 18 gauge needle on my end here. So what I'm going to do, I'm going to tend his skin like so, and then that way I can inject right in the middle. I'm not going to hit any muscles or anything. Bevel up right there in my tent. I know, sweetie. You're okay. So now I have my needle set. I can unclamp. And my administration set is dripping, and Austin can easily take up to 1 liter of fluids. He technically doesn't need it, but with a patient of his size, he could take up to that much. For a nail trim on a dog, we want to cut as much of the nail as we can without cutting the quick. And in order to do so, thankfully Turtle has light colored nails. On dark nails it's really hard to see, but on a light colored nail you can actually see the pink quick, so it gives us an idea of how far we can cut. If we do happen to cut the quick, we have styptic powder, which is Quick Stop, it's the brand name. And this will help stop any bleeding that may happen. So when it comes to actually trimming the nail, we can see Turtle has the pink here, that's the quick, and he's got quite a bit of white nail that we can trim. So if I go slowly, taking a little bit off the top, and then I can take it off the sides. I know, you're a wiggle boy. And even on the underside, like so. And I know that I still have a little bit to go because I still have some white flaky stuff, the nail underneath. Once I get further and I see more of the pink, I know you're fine. So now that I know I'm getting close to the pink, I can see the quick in the middle of the nail. A kitty nail trim is pretty similar to a dog nail trim. We want to watch out for the quick, which is pink, and it's a little easier to see on the cats than it is the dogs, because the majority of cats' nails are clear. But what you want to do, you push on their toes ever so gently, move the hair out of the way for Linus, and you can see that nail poking pretty good. Take it and ever gently clip it, just like that. And in case we do get close enough to the quick, we have styptic powder to put on the quick to stop the bleeding. So I'm going to apply a temporary laceration bandage to Turtle here. We have a fake laceration made on his arm with marker. So pretending that it is an actual wound, I'm going to start with some sterile lube. It's just been opened. I'm going to place it on the wound to prevent any debris or excess material falling into our wound. That way I can clip around it so that when I clip, it can fall onto the lube instead of into my wound. So once I'm done clipping, I'm going to take some sterile saline and I'm going to flush out the excess hair and the lube. I'm going to cleanse around the wound with some Chlorohex. I'm not going to go in the wound because that will inhibit the healing skin in the wound. I'm going to clean around it gently. And then I'll place the sterile saline soaked gauze. Then I'm going to place some cast padding around it, starting at the distal end. I'm going 50% over where we placed it previously, and since he doesn't have a very big arm, it's not going to take much. Once we've got that on, I'm going to place our vet wrap. Oh no! And now our wound is bandaged up until a doctor can see it and suture up our laceration. A bona fide Robert Jones bandage is used to stabilize a fracture at the distal portion of a limb. So the first thing we want to do is we want to place our stirrups. We want to put that on the distal third of our limb on both sides. We're going to use a tongue depressor to help keep our tape from sticking to itself and each other. And Austin doesn't have a wound, but if he did, we could place some sterile gauze on the wound itself. So the first layer of our bandage is going to be cast padding. And what we want to do, we're going to start at the distal portion of the limb, and we're going to leave the third and fourth toes out of our padding to check for swelling. We want to wrap from the distal part of our limb up to the proximal portion. And as we go, we're going to cover 50% of the padding that we've already laid. And you want to do this somewhat tight and as wrinkle-free as you can. With the modified Robert Jones bandage, we want to do 2 layers. It's not as thick as the regular Robert Jones bandage, which is about 3 to 4. So that one's a lot thicker than what we're going to do right now. So our second layer is going to be the compression layer. We're going to use some compression gauze. And again, we're going to start at the distal portion of our limb, and we're going to move proximally up, still leaving our toes out of our bandage. And this layer is going to compress our cotton padding, our cast padding. So we want it tight, but we don't want it too tight, so we don't want to cut off circulation to our limb. And again, overlapping by 50% with no wrinkles or creases. So it's at this point that we want to add our splint if we're using one. I'm going to add it to our leg here to keep it nice and straight. And we're going to wrap it with some more compressing gauze, starting at the bottom and moving up, overlapping by 50% still. Tight enough, but not too tight. At this point, you want to take your stirrups away from our tongue depressor. We're going to twist it and help it to secure our gauze layer on each side. And now we're going to use our last layer, our vet wrap, to keep it all in place. And we want to leave some of our cast padding out. We don't want this to touch the patient's skin because it can be really irritating. So I'm going to leave some of our cast padding out. And again, beginning at the distal portion, and moving proximally, and overlapping by 50%, just as we have been doing. Pulling it tight so it's secure, but not too tight. And same thing at the bottom, at the top as the bottom, we're going to leave some of our cast padding out. And you can add some sticky elastic tape to your foot to give the patient a little bit more stability when they're walking around. Still leaving your toes out, the third and fourth toes. That way your owner can check for any swelling. You want to let your client know that to look for swelling, see if the toes are separated, means that the bandage could be too tight. So to remove our Robert Jones modified bandage, we want to do it layer by layer. So we're going to start with our first layer, our outer vet wrap. And if we can remove our tape. Stick our stirrups. Cut our gauze layer. That's holding our splint in. Take out our splint. cast padding layer now. We can remove our tape gently from our stirrups. And that's how you remove your modified Robert Jones bandage. In order to administer an oral pill, there's a couple of ways you can do this. You can place it in a piece of food for the animal to consume and take the pill with it. Or if they find the pill and spit it out like Turtle does, you can administer it orally. What you want to do is you want to open the mouth and place the pill as far back on the tongue as you can, and then administer some water with it. And the best way that I have found to do this is to place my finger on the top of the dog's mouth, dog or cat, top of the mouth, open it up, place your pill in there, and then quickly hold the mouth closed while administering water through the buccal cheek area. So let's try that. I don't have a pill for Turtle. I do have a little piece of kibble, so hopefully he won't chew it. So again, what we're gonna do, we're gonna open the mouth while he wiggles, and we're gonna place it as far back as we can, close his mouth, and administer some water. We wanna be careful that we get it as far back on the tongue that they're not going to aspirate the pill or the water, but just enough that it's back far enough that they can't spit it out right away. Pilling a cat is similar to pilling a dog. You want to get the pill as far back on the back of the tongue as you can. Close the mouth, hold them closed, and then use a little bit of water as a follow-up to help them swallow the pill. Also, as to open the mouth, I also like to use the same method as putting my finger on the roof of their mouth, and it kind of helps them open up pretty quickly. So Leon here doesn't need any medications, so we are going to use a little piece of food, little piece of kibble. So, get it in the back, close his mouth, and then use a little bit of water on just under his lip. Squirt that in. There you go. He's a good boy. Taking mandibular x-rays, I have Austin in the dorsal recumbency position. So I have his tongue stuck in the back here to get it out of the way. And I'm going to use a phosphor plate since he is a large dog. I'm going to place it, what I want is his premolars on the right side here. So I have the plate with the teeth lined up on the edge of my phosphor plate. I'm going to use a bisecting angle. So the angle of the teeth and the angle of the plate, and then that angle in between is where I want to go. It should be right about here, in that area. I have all my PPE on. Put my gloves on. X-ray. So take this out of his mouth and run this through our ScanX reader. And then as that one's reading, I'm going to place our next plate for a canine radiograph on the mandible, the 404 on the right side. And again, I'm using a bisecting angle, so the angle of the tooth and the angle of the plate, I want somewhere in between. Here. And the apex of it is going to be on the rostral, probably in this spot. So I know I'm going to collect it all on my plate. Again, PPE, X-ray. Run that and see how it looks. So discussing Austin's dental radiographs that I took earlier, I did take a full set of x-rays and I did find something that was interesting, so I wanted to show that to you because it's not really found in dogs very much. It's usually very common in cats. So you can see here, this is our left mandible of our premolars. You can see the canine. So we have our canine here and our premolars. The interesting thing that I wanted to point out is this our second premolar, 306 here, the root is actually fragmented from the coronal aspect of the root here, and it looks like it is from tooth absorption. So it looks something that we usually see in cats a lot, but not so much in dogs very often, so it's interesting to find it in Austin. It doesn't seem to be affected or infected or bothering. There's no abscess there, so it looks decent. It looks okay. The other x-ray I wanted to show you is our molars on our left side, our right side, all the way in the back. We have the 411, 410, and 409. So those are our 3 molars on the right mandible. We did take this using the parallel technique, while our premolars that we just looked at was our bisecting angle technique. And these look okay. The teeth look pretty good. We do see some minor bone loss here in the furcation of our 410, but otherwise these teeth are still hanging in there. No abscesses, no periapical lesions or anything unusual. For some of those tight spaces on the coronal aspect of the tooth, we want to take our hand scaler and we can use the cutting edge to help clean up the calculus in some of those tight spots where the ultrasonic scaler can't really get to. So like in the crevice of our carnasal tooth here. For under the gum, we don't want to use the hand scaler because we can really hurt the gingiva. So we want to use our curette instead. So this one has a nice angle that we can get underneath the gingiva and stay with the tooth to help get some of that subgingiva calculus away, like so. When we do ultrasonic scaling, we want our scaler to be parallel to the tooth. We don't want to go at a 90-degree angle because the heat of our scaler can cause enamel defects and defects to the pulp chamber. So we want to go on the side, and we want to use the least amount of vibration from the scaler possible to get the calculus off. So this is coming off really nice with the side of the scaler. And we don't want to be on the tooth for longer than 5-10 seconds. So I usually like to start with the difficult teeth and be on there for about 10 seconds, and then I move away and come back to that difficult, heavy calculated tooth later. When you're ready to polish your teeth, you want to grab your Prophy paste and you want to fill up your cup here. And you don't want to keep it on the tooth for longer than 3 to 5 seconds because it can warm up the tooth too much and damage it. So what we're going to do, start it a little bit. And don't forget to reapply some Prophy paste. And you want the cup to flare just a little bit. You don't want to put too much pressure on it. And what this is doing is it's getting the microscopic pieces of calculus off and bacteria to leave you with a nice polished surface on your tooth. So Austin had a dental procedure today. He did.
Okay, good.
We were able to scale and polish his teeth. So he's going to be a little bit sedate after his anesthetic procedure today. That is normal.
Okay.
He should go home and be quiet for the rest of today. I don't want him to do any extensive exercise, no jogging, running, short leash walks to urinate and defecate is what I want for him. He should be pretty quiet. He shouldn't want to do anything for the rest of today. He can go back to his normal activity tomorrow. That can all be normal. For his food and water intake, I want you to start with small amounts of water when you get him home. With the anesthesia, it can, and the drugs that we give him, it can cause his GI system.
Mm-hmm.
So I want you to offer small bits of water at first when you get him home. If he throws up, take the water away. I don't want him drinking too much or vomiting on it, so just little bits at a time. Same thing with the food, about a quarter of what he normally would get for a mealtime. Wait about an hour, and then you can offer him some more food.
Okay.
He does have sutures in his mouth from extractions. So a little bit of blood-tinged saliva is normal. You can see it in the water bowl and in the food bowl. That's all normal. It should go away within the next couple of days.
Okay.
If there is excessive bleeding, please give us a call. And because of the sutures in his mouth, we recommend a softened diet for the next two weeks, about 10 to 14 days. You can take his regular kibble and soak it in warm water for 30 minutes.
Okay.
Or if you have a canned diet of the same diet that he's currently on, you can use that as well.
Okay.
As far as home care, what I want you to do after his dental, the best thing to do is to actually brush his teeth.
Okay.
So I'm going to show you a good way to start to train not only him to let you in his mouth, but to train you to know where his teeth are and the anatomy of his mouth.
Okay.
So what I like to do is I like to start with just a plain piece of gauze, open it up and wrap it around my finger, and notice that I use a dry piece of gauze. I don't want anything on it, and I don't want it wet because it'll just slide right over what I'm trying to take off his teeth. The easiest way is to have him with his back to you, just like this, him facing away from you. And you just have to lift up his lip and wipe the teeth. You want to get the top, the bottom, the front, those little incisors in front, and all the way back. So all the way back as far as you can, and you can feel where the teeth end. So up and down, and you don't have to worry about the inside of his teeth because his tongue does a really good job of cleaning the inside. So we just want the cheek area of his teeth. And you want to do this for about a minute every day. So you can see some nice yellow stuff on his teeth. That's the plaque that we want to get off that solidifies and becomes gross calculus in there. Eventually, I want you to graduate to a toothbrush and toothpaste. Just a nice soft toothbrush, and I'll send you home with this. And some enzymatic toothpaste, which is really for taste for him. I know, you do like it. A little bit, and we're going to use the same technique. We want to get just under his lip, and we're going to brush those teeth nice and easy. Very similar to how you would brush your own teeth. You can come at a slight angle. Yes, you're being a good boy, Austin. And this is the same thing. I want you to do it a minute every day.
Okay.
Just a little dab. Oh my goodness, Austin. On both sides. And it's not about doing a perfect job. It's about getting in there and getting as far back as he'll let you. And if you miss a spot one day, you can go back and get it the next day. Other items you can use to supplement toothbrushing include dental diets, water additives, certain toys, dental treats. Those are helpful in helping to remove some of the plaque. Your toothbrushing is going to be your gold standard of what we really want you to do. When it comes to chewing toys for him, I don't want anything that's harder than his tooth, so to test that out, if you can make an indent with your thumbnail in the toy, that's acceptable. Anything harder than that, I don't want him chewing on it because he can break his teeth, and then he'll be back with us for an extraction or a root canal.